Coming up, we will be on location at Niyan MedSpa in Ashburn, Virginia, discussing the latest advances in med spa treatments and how they can effectively help you achieve beautiful skin and the look that you've desired with one of this area's top doctors, Dr. Kajal Roy. Dr. Roy graduated from North Shore Long Island Jewish Health System and received her medical degree in internal medicine. She is board certified in internal medicine and a member of the American Med Spa Association. Welcome, Dr. Roy.
Hi, how are you?
Great. Can you please begin by telling us about some of the latest advances in med spa treatments?
There's a lot of new things coming out in med spa treatments. A few of them are the broadband light, or BBL. Another is microneedling, and another one of my favorites is dermal infusion. So BBL is a form of IPL treatment. It's an intense pulse light treatment. There's a study out that shows that it's actually causes genetic reversal in the way that our skin is expressed. So it's like the fountain of youth. It does reverse a lot of the wrinkles and sun damage that's caused with aging and sun exposure. Microneedling, here I use what's called the Bella Skin Pen. It's the only FDA cleared device that's used for acne scars. So it can treat acne scars, but it can also help kind of give you that inner glow. And with a combination of growth hormone, it gives an amazing result. Then there's dermal infusion, which exfoliates all the dead skin, extracts all of the pores, and then we have 4 different serums that you can infuse into the skin. So it's done under positive pressure, so it's actually pushed deep down into the skin, where you want a lot of your products to go.
And what types of problems do they address?
BBL treats a lot of problems. It mainly treats sun damage. So a lot of those age spots we're able to get out with the BBL treatment. It also treats a lot of the reds and the browns, so broken blood vessels on the face, vessels, spider veins on the legs. It treats active acne, so cystic acne, where you have a lot of like the bumps and the angry acne on your face. It can help eliminate that and also reverse the scars and the pigmentation problems that happen with active acne. BBL also treats hair, so you get it's kind of like laser hair removal. Microneedling is great for stretch marks, for scars, for enlarged pores. It does also have a slight skin tightening effect. And what it does is it stimulates collagen production. So it's little controlled micro trauma that you cause to the skin, and it causes the body to actually stimulate a response and lay down new collagen. So it smooths out fine lines and wrinkles, increases blood flow, so you kind of get that inner glow. It's one of those things where you kind of do a couple of weeks before a red carpet event to get that dewy look to your skin. Dermal infusion is fantastic for acne. There's a serum, it's a salicylic acid serum that goes deep into the skin, and it helps cleanse the pores, and it helps prevent further breakouts. There's 3 other serums, which I like to mention that they are safe in pregnancy and breastfeeding moms. It's a hyaluronic acid serum, which helps plump the skin and hydrate the skin. There's a skin brightening serum, which will actually fade some hyperpigmentation, so some dark spots. And then there's vitamin C serum, which will help with sun damage and sun protection.
And how are these treatments performed?
They are all performed here at Niyan Med Spa. They are the BBL treatment is done through a machine, and it takes typically about 30 to 45 minutes per treatment. Dermal infusion is also done in about 30 to 45 minutes. Microneedling does take a little bit longer because the area needs to be numbed. So the numbing time is about 15 to 20 minutes, and then the procedure itself takes about 30 to 40 minutes.
And who is a good candidate?
BBL can treat anybody with a skin type 1 through 5. I have had some success with treating a skin type 6, although it's not recommended. You'd have to go to somebody that really knows what they're doing with the BBL machine. And a skin type 6 is somebody of African American descent. Again, I have treated some patients that are skin type 6 and they've had great outcomes. Microneedling and dermal infusion can be used on anybody, any age group, any ethnicity, any skin type. It's safe.
So how many treatments are typically necessary?
BBL I generally like to start off with 4, and then a 5th treatment kind of goes into a maintenance. I kind of like to say that a lot of my patients ask, is this something I have to keep up with? And I say, if you go to the gym and you get a 6-pack, are you going to stop going to the gym? So BBL, I start with 5. Microneedling, I start with 3 treatments. And dermal infusion is one of those things where you get it done the first time and people will say, what did you do? And after about 3 or 4 treatments, you're going to start noticing the effects that it's having on your skin. And the one thing I like about dermal infusion is that it's you can do it every 2 weeks.
So how many treatments are typically necessary to get the optimum results?
As for BBL, you would need at least 4 treatments, and that's for the anti-aging. So the first 4 treatments will get your skin to where you want it to be, and then I would recommend to get on a maintenance plan. And the way that the packages are done, it's you get 4, and then you get the 5th one free, and that kind of puts you into a maintenance program. A lot of people ask me, well, what do I have to keep doing it? Yes, you do. Once you get your skin the way you want it to look, you have to maintain it. It's like going to the gym. If you get a 6-pack, you want to keep going to the gym to maintain that 6-pack. So you have to maintain the results over time. Microneedling, I generally recommend 3 treatments, and then again you get a maintenance, maybe getting it done once every 6 months to 12 months. Dermal infusion is something that you can get done every 2 weeks. You will notice somebody else will notice that you're getting something done after your first treatment. After about 3 or 4 treatments, you'll start noticing the effects that it's having on your skin. So that, it's up to you. You can get it done every 2 weeks if you like. You can get it done once a month if you like. A lot of patients will come in and say, I have an event tomorrow. Can I get it done today? Because the great thing about dermal infusion is it takes that dead skin away, so your makeup goes on smoother. Everything just looks really nice.
So what kinds of results can be expected?
You will notice enlarged pores shrinking. So the texture and the tone of your skin is much smoother. With BBL, I like to explain it as it's clearing the canvas. So it's just getting rid of everything, the unevenness, getting rid of the browns, the reds, and just starting on a clear canvas. Microneedling also, you'll get the shrinking of pores, you'll get the tightening of skin. You'll also get smoothness because of the collagen production. Dermal infusion, you'll get a lot of smoothening of the skin and lightening of the skin.
So how long do the results normally last?
Each treatment is different. So BBL is something that you would do initially once a month. And that's for the anti-aging. For example, for hair removal, you would do it every 6 to 8 weeks. The treatment results will last as long as you continue them. So I typically say once you're in a maintenance program, you get you get the treatments done anywhere from 2 to 4 times a year, just depending on how much you want to do. Same with microneedling. After you get into your maintenance program, I would do it once or twice a year.
So what other treatments do you offer here at Niyan Med Spa?
I do other injectables, so Botox, dermal filler, sclerotherapy to get rid of those stubborn veins on your legs, Kybella, and then I do obviously the BBL, microneedling, and the dermal infusion.
So you have established a reputation for excellence in facial rejuvenation, skincare, and other med spa services. Can you please tell us what separates you from some of the other med spas in the region?
Here at Niyan Med Spa, it's me. I don't have an esthetician. I don't have a nurse providing the services. So when you come to Niyan Med Spa, you're getting your services provided by a board certified physician. A lot of people don't realize that there's a lot of risk that goes with any of these procedures, especially with IPL treatments. So having your treatment performed by a board certified physician, I can jump in if something happens. I don't have to wait to consult with somebody else. So I think that's really what sets me apart, is that I'm the one that provides all the services here.
Wow, that really sounds like some great treatment options. Thank you so much, Dr. Roy.
Thank you.
Since I was a little girl, I spent a lot of time in the sun, so I had a lot of sun damage, especially on my face. So I specifically came to Dr. Roy for BBL treatment for my sun damage. It's amazing. I felt like I, in the past, had to wear a lot of makeup just to hide all the sun damage that I had, and now I wear very little makeup, or I feel comfortable going outside of the house without any makeup on. Dr. Roy has a wonderful bedside manner. She takes the time to listen and gives solid advice on treatment options. I had a wonderful experience with her.
I'm 51 years old and I've gone through menopause, and I don't have very many wrinkles per se, but I was noticing that I don't have as much fullness and elasticity to my face, and so I work with Dr. Roy, and she had said that if I had micro needling, that would help with the collagen in my face and give me more fullness and smoothness and brightness to my skin. So that's what I had done, and a little bit of Botox to some of the frown lines and crow lines around my eyes. It still looks like me. It doesn't look fake. It doesn't look that I can't make expressions. It just feels more youthful. I still look age appropriate, and people really can't tell that I got things done. I look more refreshed than before, and I look more energized. Oh, my experiences with Dr. Roy have been wonderful. She always makes sure that she is looking at what works best for me and my face and not anybody else's. She doesn't suggest anything that is not appropriate. As a matter of fact, she doesn't let me try to do more than what is appropriate for myself. So if I wanted to do more that would maybe look, fake or be too much, she talks me out of that and makes it so that it looks right and looks natural. And what I really love about her is she puts me first, she puts the patient first, and makes sure that I feel comfortable with what she's doing, and checks up on me, makes sure that the results are what I wanted. I've actually recommended Dr. Roy to several of my friends, who have then in turn recommended her to their friends and family. I've even brought my mother, who's 71, to Dr. Roy to have a little teeny touch-ups, just so that she feels, that she feels like she is refreshed and looking happy with herself.
I had Botox done. I've had it done several times. I love the results. I feel like it's made my forehead a lot smoother and just overall made me look better. My overall experience with Dr. Roy has been awesome. I feel like she's very knowledgeable. I love the results that I've had, but what sets her apart is her personality. She's very personable and makes you feel very comfortable.